This video guide is for dosing and administration of RADICAVA ORS, edaravone. It is designed to give you or the person who cares for you a better understanding of how to prepare and take your medication as you get started on treatment. Learning the steps ahead of time can help you and your caregiver feel more comfortable when it's time to take your medication, and you can always watch again until you feel ready. Your doctor or pharmacist can also answer any questions you may have. For complete dosing and administration information, please see the full prescribing information, patient information, and instructions for use at radicavaors.com. Remember to see the important safety information at the end of the video. You can also refer to the RADICAVA ORS Dosing and Administration Guide for more detail. Now, let's take a closer look at the steps for administering RADICAVA ORS. RADICAVA ORS is an oral medication for the treatment of amyotrophic lateral sclerosis, ALS. RADICAVA ORS may be administered orally or through a feeding tube. RADICAVA ORS has two different dosing schedules, one for the first cycle and one for the following cycles. If you're just starting on RADICAVA ORS, you'll begin with a 14-day cycle. After the initial treatment cycle, you'll follow a different dosing schedule as you continue with your RADICAVA ORS regimen. For the first treatment cycle, you will take RADICAVA ORS every day for 14 days, followed by 14 days without the medicine. For the following cycles, you'll take RADICAVA ORS daily for 10 out of 14 days, followed by 14 days without the medicine. Regardless of the treatment cycle, RADICAVA ORS should be taken in the morning on an empty stomach after overnight fasting. No food or drink should be consumed except water for 1 hour after administration. If you have any dietary concerns or are unable to fast for 8 hours, be sure to talk to your doctor. If you miss a dose, do not take 2 doses of RADICAVA ORS the next day. Do not take RADICAVA ORS on days 15 through 28 of the dosing cycle. Each RADICAVA ORS carton contains 1 RADICAVA ORS bottle, 1 bottle adapter, and 2 5 milliliter reusable oral syringes. Use a new 5 milliliter oral syringe and bottle adapter when using a new bottle of RADICAVA ORS. Always administer RADICAVA ORS using the oral syringe that comes with the product. Do not use a household teaspoon to measure your medicine. When you open the bottle of RADICAVA ORS for the first use, write the date on the bottle label. Throw away or discard any RADICAVA ORS that is not used within 15 days after opening the bottle, or within 30 days from the date of shipment shown on the carton pharmacy label, whichever happens first. Prior to opening the bottle before each use, turn the bottle upside down, invert, and shake it vigorously up and down for at least 30 seconds. Look at the liquid to make sure it's mixed well. If you see any small pieces at the bottom of the bottle, invert the bottle and shake for another 30 seconds, or until you can no longer see the pieces at the bottom. It's important that your medication is mixed well. Open the bottle by firmly pressing down on the bottle cap and turning it counterclockwise to the left. Place the open bottle upright on a flat surface. Do not throw away the bottle cap. You'll need to replace it after taking each dose. For first-time use of a bottle, insert the ribbed end of the bottle adapter into the bottle by firmly pressing it in as far as it will go. It's important to use the adapter to avoid spilling medication. Do not remove the bottle adapter once it is inserted. The bottle cap will still fit with the adapter inside. Do not remove the bottle adapter. Be sure to only use the bottle adapter and 2 reusable 5 milliliter oral syringes provided with the bottle. Remove the oral syringe from the plastic wrap and make sure the plunger is inserted all the way into the barrel. Push the plunger toward the tip of the syringe to remove excess air. Insert the syringe into the opening of the bottle adapter until it is firmly in place. Turn the bottle upside down and slowly pull the plunger to remove a small amount of liquid. Always measure your prescribed dose of RADICAVA ORS using the oral syringe provided. Keep the bottle upside down and pull the plunger until it goes to the last line, 5 milliliters. Do not remove the syringe while the bottle is upside down because medicine may leak out from the adapter. People who have problems using their hands may need assistance to draw up and take the correct dose of RADICAVA ORS. While keeping the plunger in the same position, turn the bottle upright and place it carefully on a flat surface. Remove the oral syringe by gently twisting or pulling it out from the bottle. Double-check the amount of medicine in the syringe before moving on to the next step. If the dose is not correct, reinsert the tip of the syringe firmly into the bottle adapter and push the plunger all the way in so the medicine flows back into the bottle. Turn the bottle upside down and repeat step 4. If taking RADICAVA ORS through a feeding tube, complete steps 1 through 4 to prepare your dose. We will soon cover how to take your medication in steps 9 through 11. To take the medicine by mouth, place the tip of the oral syringe in the mouth and aim it toward the inside of the cheek. Slowly press down on the plunger until the syringe is empty and swallow all of the medicine. If needed, you can use up to 8 ounces or 1 cup of water to help swallow the medicine. It is normal for a small amount of medicine to remain in the tip of the syringe after taking. Leave the bottle adapter inside the bottle and place the bottle cap on the bottle, turning the cap clockwise to the right to close. Keep the bottle tightly closed between each use. Remove the plunger from the syringe barrel by pulling the plunger and the barrel away from each other. Rinse the plunger and barrel with water only and allow them to air dry. When the plunger and barrel are dry, put the plunger back into the oral syringe barrel. Do not throw away the oral syringe. Store the syringe in a clean, dry place. When taking RADICAVA ORS through a feeding tube, complete steps 1 through 4 to prepare your dose. Then follow steps 9 through 11 to take your medication. Using a catheter-tip syringe, flush the feeding tube with 1 ounce, 30 milliliters of water before your dose. Place the oral syringe containing 5 milliliters of RADICAVA ORS into the feeding tube. Slowly push down the plunger until the syringe is empty. Using a catheter-tip syringe, flush the feeding tube again with 1 ounce, 30 milliliters of water after taking the dose of RADICAVA ORS. Follow steps 6 through 8 for directions on closing the bottle and washing and storing the oral syringe. A few important things to remember. When storing, keep the bottle upright and tightly closed between each use and protect from light. Keep at room temperature. Throw away any RADICAVA ORS that is not used within 15 days after opening the bottle. Do not share RADICAVA ORS with anyone else. Keep RADICAVA ORS out of the reach of children. Call your doctor for medical advice about any side effects you may be experiencing. Contact your healthcare provider or the JourneyMate Support Program at 1-855-457-6968 with any questions or concerns. The JourneyMate Support Program provides resources to help you on your treatment journey. Experienced program team members are trained to address your educational needs and provide you with personalized answers and resources for living with ALS. This program is here to supplement the resources that your doctor provides. As part of the JourneyMate Support Program, you have access to an ALS clinical educator who can provide personalized education to you and your family about RADICAVA ORS and will also provide resources throughout your treatment. We hope this guide was helpful. Please continue watching to view important safety information.
Indication: RADICAVA ORS edaravone is indicated for the treatment of amyotrophic lateral sclerosis, or ALS. Important safety information: do not receive RADICAVA ORS edaravone if you are allergic to edaravone or any of the ingredients in RADICAVA ORS. Before you take RADICAVA ORS, tell your healthcare provider about all of your medical conditions, including if you have asthma, are allergic to other medicines, are pregnant or plan to become pregnant. It is not known if RADICAVA ORS will harm your unborn baby. Are breastfeeding or plan to breastfeed? It is not known if RADICAVA ORS passes into your breast milk. You and your healthcare provider should decide if you will receive RADICAVA ORS or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of RADICAVA ORS? RADICAVA ORS may cause serious side effects, including hypersensitivity or allergic reactions, and sulfite allergic reactions. Hypersensitivity reactions have happened in people taking RADICAVA ORS and can happen after your medicine has been taken. RADICAVA ORS contains sodium bisulfite, a sulfite that may cause a type of allergic reaction that can be serious and life-threatening. Sodium bisulfite can also cause less severe asthma episodes in certain people. Sulfite sensitivity can happen more often in people who have asthma than in people who do not have asthma. Tell your healthcare provider right away or go to the nearest emergency room if you have any of the following symptoms: hives, swelling of the lips, tongue, or face, fainting, breathing problems, wheezing, trouble swallowing, dizziness, itching, or an asthma attack in people with asthma. Your healthcare provider will monitor you during treatment to watch for signs and symptoms of all the serious side effects and allergic reactions. Common side effects reported include bruising or contusion, problems walking or gait disturbance, headache, and fatigue. These are not all the possible side effects of RADICAVA ORS. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to www.fda.gov/medwatch or to Tanabe Pharma America Inc. at 1-888-292-0058. Please see the full prescribing information and patient information available at www.radicavaors.com.